So if you're going to get dental implants done, and you have strong opinions about this because you lecture and teach dentists all over the world, actually. So what should you look for in somebody that's going to be doing the dental implant procedure?
If you look on the internet, you can find tons of dentists that are offering dental implants. I mean, virtually every office now is offering dental implants. What you need to look for is the level of experience with the dentist that's performing these implants, because what most consumers don't know is that, one, there is no certification to place dental implants. Any dentist can place an implant. Two, that many dentists are receiving training for dental implants literally in a hotel ballroom over a weekend. I mean, you can get training in dental implants in less than 8 hours and get a certificate, and you can hang it on the wall, and patients will think that you are an implant specialist. You need to look at the background. So when you're seeing a specialist, so for example, a periodontist, you're seeing an oral surgeon, we are receiving anywhere from 3 to 4 years of additional hospital-based training, university-based training, where we are doing implants on a regular basis. We do these every day in the practice. It's not a side procedure that we do once.
I mean, you've done thousands of these procedures.
Oh, we've done over 20,000 implants in our office.
And most guys, by the way, because I talk to them, look, doctors come on my show. Some guys have done 20, some guys have done 30 cases. Well, so do you ask your doctor? I mean, because it seems uncomfortable. Like, how many of these have you done? Is that a fair question?
Well, I would say that's still probably an uncomfortable question, but the internet is beautiful. There's a lot of information out there. So you can really research and find who has the experience, what are their credentials, are they an actual specialist, or are they a dentist that had a little bit of extra training on the weekend at a course?
But it doesn't cost more to go to a specialist, you say?
No, and in many cases it actually ends up being less expensive to see the specialist.
Getting it done right the first time?
Yes, because there are many cases that implants were placed by less experienced dentists and problems arise, and when someone comes to see us to fix those problems, it now ends up costing quite a bit more. And also the end result in many cases. So for example, if you're talking about a front tooth, certainly taking out a tooth and putting in an implant is very easy. But there's a lot more to it than that if you want it to turn out looking right. And when you smile, that's the first thing people are going to see. And if it's done improperly, you may still have an implant that has a tooth attached to it, but it may not look as good as it can because of the manner in which it was performed, because there's certain very small minor details that can make a difference between having black triangles around your teeth and having teeth that look like they did before you were missing a tooth.
So make sure they're a periodontist or oral surgeon with a lot of experience, that they've done a lot of these procedures, and look at their before and after photos.
And read patient.
You're a guy with more before and after photos almost than anybody I've ever seen.
Yeah, we've got.
And the teeth look good. I'm not trying to endorse you on this program, but they look good.
Yeah,
they look real, I should say.
We have thousands and thousands of photos. And to get to that point where they do look real, there's a lot of pre-planning in that process. You literally have to think 8 months, ahead of time. You have to think, down the road to where if somebody does need bone grafting for a single tooth implant, if somebody does need gum grafting for a single tooth implant, most regular offices that do this as a side procedure, they can't do those other necessary procedures, additional bone grafting, sinus lifts, gum grafts that need to be done. When you're seeing a specialist such as in our office, we can do all of those procedures, and we have the foresight to know that I need to do those procedures to make this have a better end result, versus what we see many times is a dentist stuck an implant in. These other procedures should have been done ahead of time, and now it's almost impossible to go back and do the procedures after to try to make something look better, versus planning it ahead of time, and you can have an optimal end result. But you have to at least know that needs to be done. And if you don't even know that needs to be done, which is the case in a lot of offices because they don't do a lot of implants, you can't go back. You have to take everything out and start over. Now the costs are higher. The time for the patient in the chair is more. It's just not
experience matters a lot in this
completely matters.
Now, another thing, we're short on time, about a minute left. A big part, something you taught me, is look for a doctor that does it all right there. That means they have the lab there. You should ask them, are you sending this stuff out to get it done? The lab there, that both the surgeon and the person that makes the beautiful teeth are all right there.
Yes.
That's what you do.
We have everything in one house. we have the surgeon, we have the restorative specialist, the prosthodontist, and we have the laboratory personnel. So we can, in the planning process, we can digitally design the teeth. We have the CAT scan, so we can evaluate the bone. We have the input of the team. So we have the restorative dentist, we have the surgeon. So the restorative dentist may tell the surgeon, hey, make sure you're looking for this before you're doing the procedure, because I'm going to need that when we're doing the restoration. And it's a collaborative effort to where everybody's giving input, and the end result is the best tooth for the patient, because the patient's not coming in to get an implant.
And they get it done quickly.
And they're getting it done quickly because, one, they don't have to drive all over town. Two, we're planning it properly from the get-go, so we know we're doing it in the most efficient manner that's going to give the best end result for the patient, and it's going to be taken care of in one roof while they're asleep.
I was interviewing a medical doctor about 6 months ago on my show, and he just mentioned he had an implant. And he said he has to wait about 6 or 7 months until they put the tooth on it. And in my mind, based on what things like you're telling me, is that's kind of old school thinking. He probably went to a dentist, because you don't do anything like that, right?
Well, the older school of thinking was originally you would place an implant, you would bury it for 6 months, then you would come back, then you'd have to have a secondary procedure done to uncover it, then you'd have to wait another month for that to heal, and then you would have the tooth made.
That's still going on.
Oh, that's still going on, yes, completely. But there are newer implant materials, there are new advances in implant technology, biologic growth factors.
So you do it one day?
Yes, so we very frequently, for single tooth implants, can take a tooth out, place the implant, do any type of other procedures, bone grafting, gum grafting, all done in one day. Now, there is a difference between teeth in a day and regular implants. If you're doing an entire mouth worth of teeth, you can replace everything in a single day.
Okay.
If you are doing one single implant, we typically don't attach the tooth on the same day because that does...
How long is that?
Typically, you still want to let those implants heal on average for 3 months before you are attaching teeth, but you never walk out with a gap in the mouth. You don't have any missing teeth. We always make sure that we are having a restoration there to where you don't have to go with a gap tooth there. You're always going to be able to smile. You're always going to look like you. But we also want to make sure that the procedures we do, we're setting things up for the longest term success possible. And there are some dentists out there that are doing things that are immediately gratifying for them and the patient, but long term may put the implant at higher risk. And we still want things to look good, we still want them to function, but we want the long term success. Because if you have an implant and it looks good on the day of the procedure, but it fails 3 months later, so what? Now you're having to start everything over. So we want things that are going to last and function and get you what you want, which is a tooth.